So this is an opportunity. Yeah, go ahead.
I know what I want to go to.
Oh, you know what you want to do?
Yeah, me too.
What is that?
I'm going to be a zoologist.
Zoologist?
Zoology.
Yeah, no, you want to go? You want to be a zoologist?
Yeah.
Oh, are you too?
No.
Okay.
I know what I want to be.
What do you want to be?
A soccer player.
A soccer player?
Yeah.
A soccer player?
Yeah. You think you're
to represent Ghana?
Yeah. I still don't care though. David. If you become a professional soccer player, you can make over $1 million. True.
Okay. All right. I hope you play for Real Madrid.
What? No.
Hey!
No. You're not getting free donuts.
Okay,
That way.
I hope you play for Real Madrid.
Yeah, how about I guess.
Or what team do you want to play for? Arsenal? You better don't play for losers. Don't play for, oh, okay. You can represent Ghana. But okay, you have to start from here, right?
Yeah.
So you go to DC United, right? You want to play for DC United.
I want to at least be like playing the Premier League.
Yeah, if you want to play in the Premier League, that's why I said, okay, you want to play in the Premier League?
Yeah.
Okay, then you play for, let me see. Play for Arsenal, okay?
Yeah, I'll take it. He already ate it. I know I didn't. I mean, you already put hands on it, so there's no point in turning it.
So for others that have not made up their minds about what they want to do, listen, please. Okay, for others that have not made up their mind on what they want to become, this is an opportunity for you to listen to a professional in a field. You see, we've been talking about tech stuff all year long, right? Now, we're telling you about tech stuff because there are opportunities there. But there are also opportunities in other fields. This is another field that you're going to be introduced to. Please listen, open your mind, ask questions, okay? Ask questions is important. That way you'll know whether it's a field that you'll be interested in or not, okay?
Biotechnology, see?
Okay, yeah, biotechnology. You guys all know how important the healthcare field is to us, right? We all saw what happened during COVID, okay? So hopefully we're gonna learn about how biotechnology is assisting with, creating drugs that could, help us to fight all these healthcare challenges that is all around us today, okay? So please, again, listen, ask questions, okay? David, I know you want to play for Arsenal, but please, yeah, I know you do. Please listen to this, okay? And yeah, look, I know you said you want to be a zoologist, right? It's also a good idea for you to see other fields, okay? I'm not saying you should change your mind, but listen to other fields so that you can at least make more informed decision, okay? All right, team in Ghana. I hope you can all hear me.
No, they can't hear.
Okay, team in Ghana, good morning, good afternoon. Now, we're gonna have a presentation from a professional, and the ask here is that please do listen and ask questions about whatever you don't understand. I know we've been talking about tech stuff all month long or all year long, right? But this is another opportunity for some of you who really are not comfortable with tech, or let me say with IT, as we've talked about most times. So listen to this. This is a very, very important field, especially for mankind, okay? So listen and again, ask questions. So you can handle.
Okay. Over to you now.
Hi guys, can you hear me okay?
Can you hear her?
Can you?
Hello?
If you are talking, we cannot hear.
Can you hear me okay now?
Where is the,
Let's send in charge to her.
where's, okay, oh, she.
Can you guys hear me okay now?
She's talking.
Yeah, speaker.
Yes, okay. I'll share my screen again.
Hello?
Hi. Okay, so today I'll be talking.
Yeah, now, right?
You guys need your Zoom in here so that we can. Yeah.
Okay, good morning, everyone. So I'm going to be talking about careers in biotechnology today. So the agenda for today, first I'm going to just talk about some of my educational background, work experience, an intro to the biotech industry, NGS and cancer diagnostics, and kind of experience with
He's
that.
telling the truth though. He's telling the truth though. I mean, you have a little bit of. Yeah, I know, but like that's not the point. Oh.
Okay, so for my bachelor's degree, I went to Hood College in Frederick, Maryland.
And don't even hear what just happened to me.
Okay, I went to Hood College in Frederick, Maryland to get a bachelor's of arts in biology, and I graduated in 2020. And then I got my master's degree in biotechnology in 2023 from University of Maryland, Baltimore County, with a certificate in biochemical regulatory engineering. Okay, so how did I get here? And more specifically, how did I get into biotech research? So like a lot of people who start school for biology, I had big dreams of being a doctor, but it wasn't until my junior year of undergrad that I was able to get a role being a research assistant in a microbiology laboratory. And the research that I did was focused on climate change initiatives, climate crisis initiatives, and things to like rectify that situation. So the title of my research project was Engineering of Melting Temperatures of Carbohydrate Binding Domains. Basically, it was a way for us to modify these molecules in order to reuse for biofuel production, which is a way of like producing natural energy. And then from that, I was able to present at a bunch of different symposiums, which are basically just like science showcases where other scientists go to showcase their work. One of the ones that I did was at UMBC. And that kind of encouraged me to look to higher education and look more deeply into working in a lab. And from this, I was able to gain a lot of more hands-on experience working in a lab and also pivot away from the medical track because I found something that I really enjoyed that was not medicine. Okay, so work. So since I graduated from undergrad only 3 years ago, there's not like I have a ton of work experience, but the two jobs that you see at the top, the research assistant and near peer mentor / lab teacher, those were jobs that I did when I was still in college, getting my bachelor's degree. And then immediately after graduating, I started a job as a quality control analyst at Smith & Nephew, which is a pretty big biotech company here. And then personal genome diagnostics, I work there as a quality control analyst, supervisor, and then currently I'm now a process engineer. So I'm going to talk a little bit about kind of what each of those roles were, what they taught me. But overall, all of these roles are just kind of like different ways and different functions of saying that like I applied biology and science into a biotech role. Okay, so undergrad jobs, being a near peer mentor, basically was just teaching laboratory classes to high schoolers, middle schoolers, and elementary school kids. And it focused a lot on like molecular biology skills, physics skills, and forensic skills. and it enforced a strong understanding of like basic techniques like PCR and gel electrophoresis. So the image that you're seeing over here on this side is kind of how you set up a gel, and then kind of the image that you'll get from after you run a gel. And then when I was working as a research assistant for the project that I talked about previously, it was more of an independent research thing. It gave me a lot of exposure to microbiology techniques and bioinformatics skills, and it was able to help me perfect some of these techniques that are used in um, industry settings. So obviously like gels and cell culture, and then what you hear here are like flasks that you use to grow cells in. All those skills are things that you use like in a work setting. And so having these experiences while I was in college definitely helped propel me into my career immediately after I graduated and made it a little easier for me to get jobs. Okay, so then when I worked at Smith and Nephew as a quality control analyst, there I worked at kind of a subsidiary of Smith and Nephew. It was a place that took care of creating wound care products. So it used placental tissue as a form of advanced wound care. The cells and growth factors and hormones, they have positive effects on severe injuries. So a lot of times we'd be treating people who had burns or were at risk for amputation. And then they used our products in order to help reverse the effects of those injuries without having strong like side effects or having to go through like severe surgeries. So my job there as a quality control analyst was just to test the different products. So most of the things that I tested were placental products or bone tissues. And so on the images over here on the right, you see some of the kind of tests that we had. So I did like cell staining, which is a way of checking if they're viable cells within a sample. And then what you see here is called like a microplate. And we did that to perform ELISAs, which is the labs that we worked in kind of look like these ones that you're seeing in this bottom photo. And then here is actually one of the images of one of the products that we got. So this is one of the placental tissues that we use to be able to treat people. And that I used to be able to test samples to make sure that they were effective and safe for our patients. Okay, so before I talk about my next roles, I want to talk a little bit about personalized medicine and just a very like high level fashion. So personalized medicine is kind of a subset of biotech. Um, there's a lot of different jobs that you can get in biotech, but personalized medicine is one part of the industry that's really been getting more and more popular because of the benefits that it has to patients. So in a really, really simple, high level way, basically in the way that like we work, we treat people who have cancer, or we diagnose people who have cancer. So basically the patients, they'll get liquid biopsies. So we'll take like a blood sample from them, and then those samples get sent to our facility or a lab, or even sometimes a hospital that is running the tests that we create. The patient samples are then tested by next generation sequencing. So the DNA is sequenced and it shows us specific variants or mutations, insertions or deletions that a person might have. And by being able to detect their biomarkers, we're able to get a patient's like specific cancer biology, and that's used to create a diagnostic plan that's tailored to that person individually. So the benefit of personalized medicine is that there's a chance that it can give patients a higher chance of survival by having a diagnostic plan that's tailored to them specifically. And the liquid biopsy option is obviously a safer, cheaper, and less invasive alternative to traditional biopsies, which is when a doctor has to kind of like surgically remove something from the patient. And in this way, they're only removing blood. So it's pretty simple. Okay, so when I was working in the quality control roles at PGDX, we focused on creating the kits that people would use to do these personalized medicine tests. So there, I performed various NGS tests to confirm that the kits themselves were working properly and that they would give us the right results for our patients. And I was able to create and supervise a team of other analysts, so train them in all of the advanced assays, teach them how to use different equipment and be able to troubleshoot problems. I helped create assays for the QC team along with a lot of cross-functional help from other scientists and bioinformatics teams, and then performed investigations, experiments to better improve our processes, improve our assays, and be able to ultimately create kits that we can use for patients, ship them.
Kayla,
Yes.
I am so sorry. So the kids are saying that you are talking too fast. So if you can please slow down a little bit for them to absorb all the knowledge that you are pouring, please.
Yeah, for sure. Do you guys want me to just start the slide over?
Do you guys want to start over?
No.
Okay, what a,
I was confused on the definition for personal.
okay. One of the students says she wanted you to go over the personal medicine parts.
Okay.
Thank you.
Yeah, no problem.
Team Ghana, please, I know it's hard. We are recording, so you can go back and rewatch it, okay? And if you have any questions, definitely ask, okay?
Can come off mute and talk if you have any questions.
As long as you are joined on Zoom, you can come off mute and ask questions. Thank you, Makhalia.
Yeah, no problem. Okay, so question about personalized medicine, like what is it? So basically it's a way of creating plan that's specific to one person to be able to treat them for a disease. There's a lot of different types of personalized medicine out there, but the one that I work in is for cancer diagnostics treatments. So when a patient has cancer, they want to know like what type of treatment plan would be like the best kind for like this specific person. So they get their biopsies done, they send the blood, they send the sample to us, and then we do sequencing on it. The sequencing tells us a bunch of information about this person's DNA, about their genomic patterns. And then from that, we're basically able to give oncologists, based on the data, a plan that says like, these would be the best treatment options for this person. Does that answer the question? Okay. So then in quality control, talked about this a little bit already, but basically the job there is just to make sure that the materials that we're using to test these people's samples, to test the patient's DNA work properly, and that they're able to give people accurate results. So here, this team, or in this role, it was both kind of a combination of like the science work of being able to perform the tests, investigate things, perform experiments, but also kind of a supervisory role where you're able to build out a team, help people grow into the team, help people learn new skills. I have a little video here and we can circle back to this, but it just explains kind of like the basic steps of NGS, which is a really cool and interesting technique that is used to do genomic sequencing. We can circle back to that if we have time.
No, you can play.
Okay.
But the kids love stuff like this, so.
It'll be really short, only about a minute. Can you guys see the YouTube screen?
No. Okay.
This.
The volume. We cannot hear anything.
Unshare your screen and then share again with audio.
Are you unable to hear the audio?
Yeah, we couldn't
Yeah,
hear
we
the
can't hear.
audio.
Unshare and then share again with audio.
To even the most experienced molecular biologist, next-generation sequencing can seem complex and intimidating. This quick video is designed to give you a basic introduction to a typical NGS workflow to get you off on the right foot. All NGS workflows start with input DNA. It's then converted into a DNA library. This library preparation step is crucial. USeq sell easy-to-use kits and tools to help you with this. Once ready, the DNA library is loaded into a sequencer, and then after sequencing, the data is analysed to reveal your results. There are hundreds of different methods for library preparation, but most follow the same principles. The sample DNA is fragmented into small pieces. There are several methods to do this that we discuss in other videos. These small pieces are called inserts. Then little DNA tags are added to the end of each insert. These tags are called adapters. They allow the inserts to bind to the chip in your NGS instrument. Finally, you quantify your library, dilute it accordingly, and it's ready to load onto your sequencer.
Any questions, comments? Okay.
Okay, cool. So that was just kind of a brief overview of what that workflow kind of looks like, more or less. Okay, so then following on to like my current job. So before I transitioned to this, I was working more on like the manufacturing side. So that means creating the kits and making sure that they are safe and effective for customers. Now I'm working more on the product sustaining side and transferring side. So that basically means when scientists create a new product or a new assay, they need a team that is specialized in a certain skill set that allows them to be able to move all the products into something that's sellable and something that can be FDA approved. So that's basically what my job is now. So I help the research and development team make protocols, make validations, and just do everything that's necessary for us to be able to create a sellable product that we can give to patients to help them. So basically, it bridges the gap between research scientists and then the commercialization team. So a lot of that involves doing technology transfers, which is basically creating an entire data package that says this product is safe, good to go, and that we can make it a lot of times. And each time that we make it, it will be the same. It'll be equal safety, equal quality each and every time for our patients. We help to do FDA submissions, which is just the regulatory body that says that products are safe or not safe for patients to use. Audits and then continuous improvements, because one thing that we always want to do in any organization, any field that you want to go into, is always try to strive to make things better. So basically this role is just combining like genetics and biology to become what I would like to call like a professional problem solver. The circle that you see over here is kind of all of the really important steps of being a process engineer or designing a process just overall. So obviously asking constraints, researching problems, being able to imagine solutions, plan any proposing solution, create, test, and then continuously try to improve the assay, improve the processes, improve the product so that they're better, safer, more efficient for our patients. Because ultimately, the whole reason why we do this is to help people and to use science to do that. Okay, so let's talk a little bit more about biotechnology just overall, right? So like I said, I did a bunch of different like type of biology jobs, but biotechnology is a lot bigger than any of the things that I've done. So there's biotechnology, regulatory science, pharmaceutical, which is basically like medicine manufacturing. There's scientific information management, molecular, biodefense. There's agriculture biotechnology. So basically there's something for everyone. If you're interested in working with like growing cells, there's something for you there. If you're interested in combating the climate crisis, there's something for you there. If you're interested in working for the government, there's something for you there. Anyone who has interest in biology, science overall, IT, computer science, cybersecurity, bioinformatics, there's some place for you to fit within the biotechnology realm. Okay, so one thing that we wanted to talk about also is just levels of inequality that are here. So I pulled some data from BioC, which gives reports about statistics that are in biotechnology. So like a lot of other STEM fields, there are some levels of inequality within the biotechnology field. Specifically, we see that at like higher levels. So higher levels of inequality when it comes to executive level positions and board level positions versus levels that we see when we're looking at lower level employees. We see that both in gender, race, ethnicity, but there's still hope. So within the US, there's a ton of growth that we anticipate happening over the next 7 years within the industry, within the biotechnology sphere in the US, but also all over the world. And so with growth and with the current push to close the gaps of inequality and inequity within the industry, there's a lot of opportunity for anyone to find success within the biotechnology realm. My advice would be to, if you have interest in this, finding mentors, finding programs like this that allow you to explore the things that you're interested in so that you can find, something that you're really passionate about within this industry, because there's so much that I can provide and so many ways to help people doing a variety of skill sets here. And then lastly, I wanted to give you guys some resources here. Some of these programs are programs that I was able to do when I was in high school and college, and they really helped me try and find my passion within STEM and STEAM. And so this first program is for gains in engineering and math program. That's one of the jobs that I talked about being a mentor in. And basically it helps people who are in middle school, elementary school, high school, gain different skills that are related to engineering, math, technology, a lot of things, but also once you go into college, you can work for this program to be able to provide that same kind of support for people who are younger. The Unite program is a program for elementary school, middle school, and high school children who have interest in STEAM. And then Camp Invention is a camp that it does exactly what it says. Like it encourages people to invent, create and innovate different products to solve problems. And all of these are global programs. So yeah, I'll leave those resources with someone. And that is the end of my presentation. Open for questions now.
Thank you very much. Thank you.
Any question for Ms. Makhalia?
Any question? Yes,
Any question? Team Ghana?
I have a question.
Okay.
Sorry. You go first.
Yeah. Oh, Juliana, you have a question? Go ahead. Juliana, you can go ahead, ask your question.
In the case of the biology things, I know you said that if you have an interest in going to the government field, it helps. Could doing this also help with forensic sciences and anything in that area?
Yeah, so one thing that I definitely like agree, I would say that there's probably more biotech jobs if you're more I guess like biochem engineering, yeah, that's me. Engineering focused, but there's definitely opportunities if you're interested in forensics as well. I definitely work with a couple of people who have master's degrees and bachelor's degrees in forensic science. I think that I think that in terms of like government, if you want to get like a forensic science job, sometimes that requires a bit more experience, internships, things like that to be able to find something because the roles are a little bit, there are fewer roles in government for forensics as it is in like other things in biotech as well, but it's definitely like very, very, very possible. And if you would like, I can send you some resources that I think might be like relevant to you if you are interested in forensics. And I do want to also add that just because you're interested in like STEM or STEAM overall doesn't necessarily mean like biotech is the only way to explore those options. Because biotech definitely is like kind of merging the business alongside with like the science technology aspects of it, but there's other ways to explore like forensics or other aspects of STEAM without necessarily being involved in like the biotech world overall. I hope that answers your question.
Thank you.
Thank you very much. I have a question. I hope you can hear me. Right, I have a question, and the question is this. Now, in your presentation, as part of your work experience, you did some research, even though it is not so broad about cancer. Now, my question is, there have been so many work done towards getting a cure for cancer, and really from your own perspective, because you are much closer to the industry than I am, do you really think that we are closer to a solution, meaning that a cure for cancer? Because at least in the last 15, 20 years that I've been following this, to me, it's still the same. I'm not even sure whether we are getting closer, because each time the hope is raised that, oh, somebody discovered something. But at the end of the day, we are still back to where we are, still no solution. So do you think really there is a solution, or we are just being, I don't want to say being lied to, but is there a solution? Let's start with that.
Okay, yeah, no, that's a good question. It's kind of a hard question to answer. I personally, and I think that maybe a lot of people would agree with this. I don't think that there's ever going to be a time that someone says that there is a quote like cure for cancer, right? Like, I think that if someone has cancer and then they go into remission, I think that's great. But I don't think there's ever a time where healthcare professionals are going to say it is not possible for this person to ever get cancer again, because even after someone goes into remission, it's possible for it to come back. I do think in recent years, there's been a lot of really awesome, great technology that has come out that has been able to like help combat some of these things. But I do think that like cancer, the prevalence of it, and with people living longer and longer lives, more and more people are going to get sick. And I think that that's just unfortunately a really sad fact. I also think that like we have made a lot of strides to create treatments and stuff, but even within like the last 10 or 15 years, it takes a long time for a treatment to be able to be created, be manufacturable, go through clinical trials, and and for the treatment to actually prove that it is successful and that it will stop or prevent people from having cancer for years down the line. Some of these clinical trials can take like a decade. And even after then, like at any point in time through any of those phases, a clinical trial can fail. So I think like sometimes it's hard because in the news you'll see stuff and it'll say, this person just discovered this thing that could cure cancer. And like, yeah, maybe that's possible, but maybe when that person went through clinical trials or that company went through clinical trials, they found out that this specific treatment, while it cures like this specific type of cancer, maybe it does, or not cures, but treats a specific type of cancer, maybe it causes some other like really bad side effects. I think that it's a lot more complicated maybe than it seems. And I don't know if I have like all of the answers, but I think that there's some strides that are definitely being made, but I think that we still have a very long way to go.
Okay,
Thank you.
All right, thank you.
I have this question,
Thank you very much.
and I'm gonna stop sharing my screen if you want to share your screen back. And the question I have was on the demographics, right? On when it comes to race, when it comes to the number of people in this industry, because I want our youth to see that there is a major need. And if you can even bring to our attention when it comes to representation, why it matters that some of us, the youth that are growing up and stuff, will think about launching into these career fields.
Yeah, I think one thing that I kind of struggle with
Oh,
seeing very many like professors or having mentors that look like me, and sometimes not feeling so secure that, like, you know, when you look around in a room and you don't see anyone who looks like you, or you don't feel like you're being represented, sometimes I can definitely, all the time, it's a challenge, right? I will say that there's mentorship programs that are out there that helps, but obviously in order to get more people involved and to solve that problem, it takes all of us being a part of this industry. I will also say, I think that those stats that I showed, like, are US like specific and global, but also depending on where you work, sometimes those things are not as like prevalent. So like currently, like, I work in Baltimore City, and while working there, I think that there's like a lot of diversity within like the company that I work for. Most of my bosses have been women of color, and I've been really grateful and lucky to have that experience, to be able to learn from people who look like me, understanding the challenges that I have gone through to like succeed in this industry, to help me like navigate through like racial barriers. That has been like very helpful, but I do want to emphasize that like that is not always the case. Before I was working in that before I was working in Baltimore, I definitely was having, it's difficult. I'm sure that you guys have all experienced it. It's definitely difficult to navigate this field without some type of support. So definitely, I think one way that kind of like helps in that case is having mentorship from people who have similar experiences to you, to help you navigate through some of these like racial biases or inequalities, or be able just to help you like navigate and grow and support you through this, because it definitely is something that like is still within industry, but hopefully something that will be changing very soon.
okay, thank you. Any question from Team Ghana? Frante, does anybody have any question for Miss Makhalia Edra?
Madam, please, I have a question.
Okay.
Madam, maybe if I want to pursue biotechnology when I grow up, what advice would you give to me?
Okay. Makhalia, over to you.
I would say one thing, and I wish that someone had told me this probably a little earlier, is that you should explore every avenue that you want to. There's so much out here and so many ways to be successful. You should find the things that you're passionate about, because you'll make money. I think that it's possible to make good money in this industry doing anything. And I think that the pressures to succeed sometimes forces us to take roles or explore things that maybe are not like the things that we're the most passionate about. But like I showed you guys before in that like one chart, biotech encompasses so much. There's so many ways to help people. There's so many ways to be involved. There's so many different avenues that you can take. So like if you like cybersecurity, explore it. If you like bio, explore it. If you like chem, explore it. Explore all the things that you can as young as you can, so you can find the things that you love, because there's a lot of ways that you can create your own roles doing all the things that you want and helping as many people as possible. Like anything that you want, you can do. So yeah, that's my advice.
Prince, did you get what she said? Okay. Anybody else?
Yeah, I have another question,
Mhm.
sorry. So how you got into this field? Was it because your love for biology, or you were really interested in science? And I ask because many of the youths today, they may like a particular subject and not the other, right? And I'm telling you from because of my kids, they are interested in maths and then not interested in maybe biology or something. Now, for you to get into this field, do you have to be really interested in biology or physics, or how did you actually made up your mind that, okay, this is what I want to do?
Yeah, so in high school I took a lot of like engineering classes, and for a while I thought, oh yeah, I want to be an engineer. And then like as I got further into the coursework, I was like, actually, I don't like this, but I know that like I want to do something that like helps people. And so through like the classes that I took in high school, I was able to find like kind of a passion for science in general. And when going into college, I was interested, or at least I thought that I wanted to be a doctor. And it wasn't until I got further into my coursework and had like lab experience that I realized like what I was actually passionate about. I think to be in the biotech field, you can literally have passions for anything. You don't have to like biology. There's a lot of people that I work with who don't know or like haven't really had a strong background in biology or in chemistry and engineering or anything like that. Some of them have PhDs in mathematics. Some of them have PhDs in a whole host of things. Some of them have MBAs. There's something for every person. Um, if you want to do, if you're most interested in math, you can do it. If you're most interested in engineering, you can do it. If you're most interested in business, you can do it. Um, I think in terms of narrowing down how I wanted to get into this career, I graduated during 2020, so like the height of COVID. So I actually didn't know that much about like the biotech industry. All I knew is that I wanted to like work in a lab and I wanted to do something that helped other people more than it helped myself. Um, and so like I didn't know that much about biotechnology as an industry because it's not something that was really taught at my college. So I kind of just like fell into the job because there wasn't a ton, or I kind of fell into like my first job because there wasn't a ton of things kind of like available because of the pandemic. Um, but I think that I'm just like very grateful that I got placed somewhere where I was able to learn a lot and figure out the things that I really did enjoy and really didn't enjoy. But I would say like for your kids, they're in the perfect program to be able to explore what they like and to learn more and more about what they like, because that will definitely put them light years ahead of where I was when I was their age.
All right,
Awesome.
thank you very much.
Thank you. Any question or any comments? Francie?
This madam, what are the difference between biochemist and biotechnology?
Okay, Makhalia.
You said when did I decide between biochemistry and biotechnology?
Yeah, what is the difference? Yeah.
So you can be a biochemist working in the biology field. It's pretty broad range. For me, I also just don't love chemistry. So after taking like a lot of biochem classes in college, I was like, yeah, this is like not for me. But there are plenty of roles where you can be a biochemist working in biotech. Biotech literally is just kind of blending together all of like the STEAM different sections and adding like a business title on it. So in biotech, product, you're selling a service to patients, to customers, to hospitals, something like that. But there's definitely like a way to do anything involving in STEAM without putting a business front on it. Most of the time that will be like you're going into like academia to like teaching or doing research or working in some type of like government sector.
Michael, did that help? Did she answer your question? We can't hear you, Francie.
Yes, madam.
Okay. Yeah, the video is on YouTube, so you can always go back and rewatch to understand more of what she's saying. Now, my other question is on the career growth, or I'll say you shared a slide on where is this industry going or this type of career going? Because sometimes we hear people say, hey, this is not like there's no that much jobs in this industry or in this type of career field. So can you also emphasize more on how important this job is to the world, you know, how important it is to our community, our nation, and also the rest of the world? Because you said something about giving back. That is what gives you that passion, like the fact that you are contributing to something. So I want you to also share with them how important is biotech when it comes to, I would say, the ecosystem of our world, our community, our nation. Thank you.
Yeah, that's a great question. So I would say like, one, there is a ton of growth in every sector of biotech. And I think that globally, that's going to continue to be a trend that we see as more diseases come up, as there are new therapies that are created, as, you know, the prevalence of disease increases. There's always going to be a need for more products, more testing, more support for the healthcare industry. I think that's something that we saw with like the COVID pandemic too. Like suddenly there was this new virus and we needed support from biotech industries, from research, we needed so much support to be able to push vaccines through, to push treatments through. And we're going to see that in times of like the pandemics, but also for things that have been around for a long time. We'll need industry professionals to treat cancers, to treat viruses, to treat literally everything. So the growth there is going to continue to trend upward. And then in terms of like the impact, I think we've all had like family, friends, or even ourselves been sick at one point in time. And I think that the most important thing to remember about working in this industry is that you're doing something that, you know, helps other people. And the impact can be as big as you want it to be. If you want to create a product that changes people's lives, if you want to create something that, you know, if you have a dream of having a drug that diagnoses people with something or treats people of cancer or something like that, like it's possible. All of it is possible. The impact can be as big as you want it to be. And I think that a lot of like what I do at work, what makes me feel fulfilled and excited about continuing to move forward is feeling like I work at a place where I believe in the mission and that it can have a global impact, that we can treat people or that we can diagnose people in my city, that the kits that I am helping to create now could diagnose someone that I love, that I could help them get treatment, but also it could help someone in Japan. It could help someone literally millions far, far, far away, you know? So the impact is as big as you want it to be. You could be helping your neighbor, but you could also be helping someone halfway across the world.
Nice. So Team Ghana, Team USA, I hope you got that this kind of industry, your impact or giving back to your community, to your nation, to your world is broad. And we know about the United Nations, we know about the USA, we know about World Health Organization. And for example, during the pandemic, when they had all this COVID testing and all those things, these industrial companies, they ship tons and tons and tons of medical supplies, you know, how people can even do the COVID testing all over the world for everybody to have access to it. So when it comes to biotech, it's it's a very much needed service to our nation, our community, and even the world. And so if you are thinking about it, you have to also see that it will not only be beneficial to you when it comes to income, right? But because sometimes we always think about how much am I going to make? But it's also going to be beneficial to you knowing that you are contributing to this world that we are all, I guess, taking advantage of some ways, somehow. So before anything, does anybody have any question before we end this session? I have one last question, but anybody have anything to add? It's too crazy. Naima, you have anything? Okay. Jason, David. Okay, so nothing. So my anybody in Ghana have any question or comments? Okay, when you leave, that's when they'll come and ask us questions. Watch. But my last I'll say questions like, I know you gave a breakdown of how you landed where you are right now. Can you give your last let's say tomorrow is okay, Monday comes and you go to work. From your day to day, what do you do? You know, some people might be thinking that you're always in the lab just doing all this laboratory work or something like that. So on your day to day, what does Makhalia do when she goes to work? Let's say from Monday through Friday, really transpire, what happens?
Yeah, that's a good question. So honestly, it does vary from day to day. A lot of the assays that I run are like multi-day assays. So it might be like 6 hours one day, 4 hours another day, 2 hours another day. But I would say like in general, I start the day having meetings with my team. And then we establish, experiments that we want to do, investigations that we want to do, map out different things like that, present those things to like a cross-functional team. So one thing that I really enjoy about my job, and all the jobs that I've had so far, is that the work is not entirely independent. Like when you go in the lab and you get to like tinker around with things and experiment, that's kind of by yourself, but you get to analyze results and present those to other people. You get to hear other scientists' feedback. And one thing that I really enjoy is that I work on a team where I'm one of the youngest people there, and a lot of the other people have a lot more, life experience than me, work experience than me. A lot of them have like PhDs and like amazing, incredible things, and I get to learn a lot from them. So a lot of times it's, I go in the lab, I do whatever, and then I present the data to my cross-functional team. We decide what we're going to do the next day, and the cycle kind of like repeats. There's also like days where like I get to help with like audits and things like that, and like things like that are really special because you get to learn a lot about like regulatory bodies and stuff, and some people even get to like travel with things like that. So each day is a little bit different, but in general it's some combination of like lab work and also like doing meetings, presenting data.
Okay, thank you. So meeting, presenting data, doing lab work, but above all, it's more what team work. There is no I, there's no me. It's what there are cross-examination that is going on, or peer-to-peer reviews. So I hope you guys got that. There is a major need to work for us to collaborate and to learn to partner up with other people. I hope that makes sense. So if any question, any comments from even our teachers. So the reason why Makhalia, some of the kids are dropping out is internet issues in Ghana. So we are happy to record so they can go back and rewatch everything that happened. So that's what is going on. Any question, any comments? Nothing else? Okay, so what do we say to Miss Makhalia?
Thank you very much.
Thank you so much.
Yeah, thanks for having me.
Thank you.
Thank you. And so once again, today we've learned about biotech, right? So we hope that as we keep going, we will connect more with professionals in different industries to allow you guys to see what is out there and to prep you up And above all, as you can see, she is this beautiful lady, you know. Sometimes what is a scientist or what is a biotech person? There's no what is it called? Code or looks when it comes to those stuff. It's all about what being prepared, having that passion to what make an impact. And so don't ever say that the way I look does not qualify me to launch into any of those industries. It doesn't matter. It's all about what determination. And also one thing I love that she said was what mentorship. So if there is a place that you want to learn about, look for somebody that works in that industry. I know Juliana is in high school. She's going to 11th grade and she's getting ready for college. So she's always been talking about she want to do forensic scientist. And so today you coming here to talk, it's a boost for her to really know exactly what is going on behind the scenes and to prep up. So Julie, if you ever want to talk to Miss Makhalia, let me know and I will send you her email and then you can really chat more with her. And the amazing thing is that she went to Hood College here in Frederick, Maryland. You know, sometimes we think that, oh, we have to go to some huge, I don't know how to explain, you know, some popular school or college or university to make it work. No, it's all about what? Preparation, network, and above all, internships and all those things, or volunteering to really get your foot at the door. So if there's nothing else, I think we're going to end our career session and then we can relaunch back to working on our virtual machines. Anything? Okay, so thank you so much for helping us learn about your career. And if you know any professional that want to help us too, please bring them on board. Thank you so much.
Yeah, will do. Thank you. And if anyone wants to keep in contact, yeah, please reach out. You can have my contact information. But yeah, have a great day, everyone. Thanks.
You too. Take care. Bye. Okay. I hope you guys liked it. I know sometimes like, oh my God, the person's in your face to talk, but it helps the Ghana kids too, right? So that it's on Zoom, we are all learning. And thank you, Naima, for taking notes. I didn't see anybody taking notes. It's helpful. Right now, it might not make sense, but one day you like, okay, what the heck? And then you go back and review like, oh, we had a conversation with this person, blah, blah, blah. That's what they talked about. There is nothing, it's called about exposure. Our goal is to expose you guys to as many resources, as many information as possible. I didn't get that. I didn't get this stuff. That's one of the reasons why I love organizations like the Boys and Girls Club, all those amazing organizations that we have in our community, because the goal is what? Expose, so that you can have as many options before you. And she said what? Try different things. Don't ever say, this is not for me. Try different things as much as you can, okay? So that will be it, and we will let Miss Uncle need to start off with our virtual machine. Since today's our last day.
Today's our last day, yeah. So I think it's a good way to just recap what we've learned before we go on break. Okay, so I'm gonna be asking you guys questions about what we've learned. Okay, and we have about 45 minutes, and let's see if we can have a discussion. Okay, all right, so I'm gonna start from the most recent. What is a virtual machine? Okay, go ahead. Go ahead.
A virtual machine is a computer inside of a computer that doesn't physically exist. It might physically exist, but you can't touch, but it's like a computer inside of a computer.
Excellent. Thank you very much. That is, I hope you can all hear. That is a virtual machine. Okay. Another question. What is the importance of
a virtual machine, or what are the importance of a virtual machine? Okay, go ahead.
You multiple computers to fulfill an assignment, but we have the money, no space, or outlets for multiple machines. So only one physical computer and we can make multiple. But then we can decide that this is the computer. So if you have multiple computers, you can only instead of having three active computers.
Thank you very much. Yes, it saves you space, it saves you money that you have been spending on electricity, and also it saves you money that you have been spending on cooling. Okay, good. We're talking about virtual machine. Yeah, we're talking about virtual machine. Okay, good. Now, next question. What is a router? Yeah, go ahead.
A router is a paired switch network that
Is it what?
acts scope network. Connect to or more networks together.
Okay, excellent. What is a switch? Yeah, go ahead.
A switch is like, something that what they use, like, if you maybe if there's an input running through it, if you can make it decide if the input goes through it or it doesn't go through it, that's one type of switch.
Yeah, so a switch, yeah, thank you for that. I get what you're saying. Yeah, thank you. So with a switch, you're able to connect multiple devices to it to share a single resource. So let's say you have one internet in your house. Okay, there's only one internet, and you want multiple computers to share that single internet. So you install a switch, which will make it possible for all the computers you have to share that single internet. Okay? Okay. What is a firewall? Yeah, go ahead.
A wall that can protect, the things that can come. A firewall is programmed to protect the things that can be into your computer, and the things that can be in your computer can pass through the wall.
Good. Thank you. So a firewall is a device that protects your computer or your network from anything that is coming from outside. Okay? You want to ask a question? Yeah, go ahead.
Can you set the device or the device is a physical thing that you can touch, and the firewall is a software. And cybersecurity is something you can't touch it.
Oh, see that again now.
You said the firewall is a device, but a device is the operating.
Yeah.
But a firewall is not physical, it's software, it's not in your actual device.
Yeah. So there are two types of firewall, the hardware firewall and then the software firewall. We talked about that. Okay. The software firewall is the one you install directly on your computer, and that's what we call the host-based firewall. Then there is a hardware firewall, a device that can protect your entire network. Okay, so there are two ways you can go about it. If you want to protect just individual computers, we can install a software firewall on all the computers. Or if you want, I'm sorry? Yeah, if you want to protect the entire network, right? Because look at it, if you have 500 computers and you want to protect all these 500 computers from any attack from the internet, okay, you can either get the hardware firewall, one device that will protect the entire 500, or you can have a situation whereby you install on each of the 500 computers. Okay, which one do you think is easier to do? Right, get the hardware, right?
Yeah.
And then protect. So you have that option. There's a software firewall and there's a hardware firewall. Okay. All right, good. Next question. Okay. What is cybersecurity?
All right.
I want someone that has not answered any question. If you know you've not answered the question, what is cybersecurity? All right, Team Ghana, what is cybersecurity? Anyone? Team Ghana, what is cybersecurity? Anyone? I can't hear you.
They're muted.
Yeah, unmute and then answer the question. Team Ghana, anyone? Huh? You can raise your hand under the table and I will see it, right? If you want to raise, is this not how to raise your hand? You bring it on out.
At least you
Is it-
over.
is this
At
how
least
you-
you were over your computer.
Is this how to raise your hand? Yeah? Is this how to raise your hand?
He's raising his hand.
Raise it up. Yeah, that's how to raise your hand. No. Okay.
I want to
Anyone
answer.
from Team Ghana, what is cybersecurity?
Can already answer a question.
Can you hear me? I'm not sure if you can hear me.
Can you guys hear him? Frederick? Okay.
I want someone from Team Ghana to define cybersecurity. I know you guys already know it.
Let me give you a thing. Does it look like they can hear you? Last week it went perfectly. Today is another wahala. Oh, Jesus.
What was the question? Sorry for saying here. But you said that you have to, it has to be a person that has to answer a question.
Yeah, that's what you usually do. Wait.
Hello, team in Ghana.
What is cybersecurity?
Hold on. No, we are using this. Look, he's using this one.
Oh, this battery is even dead.
Oh, yeah, that's it.
Yeah.
Adam. Sir, cyber securities are all the tools and safety precautions we use while we are online to protect ourselves. Sir. Please, sir.
If you guys are talking, we cannot hear you.
Okay, can
Please,
you,
sir.
Can you hear now?
can you hear Julie?
A little bit, yeah, but it's still muffled.
Hello?
Yes, we can hear from you now.
Okay.
Okay, so, yeah, what do we mean by cyber ethics?
Okay, so now.
What do we mean by cyber ethics? All right, go ahead.
The rule of how you're supposed to use the internet, which is also followed by the Ten Commandments.
Yeah, so the question is, what do you understand by cyber ethics?
Okay, you're listening. No, you say,
The regulations,
You said regulations.
the rules and regulations.
yes, thank you. And you're also correct. So there are rules that we abide, that we promise, okay, to abide by anytime we are on the internet, okay? So our use of internet, there are rules that surround how we want to make use of, how we want to use it, okay? So if we all agree to that rule, or to those rules, I should say, because there are about 10 rules, okay? If we all agree to those rules, then the internet will be a very safe place for everyone, okay? So who can tell me any of the rules that they remember? Yeah, go ahead. Thou shalt not use the computer to steal. Okay, that is one of the rules. Yeah, David.
Thou shalt not use the computer to bear false witness.
Thou shalt not use the computer to bear false witness. That is true. Anyone from Ghana? Anyone from Ghana?
Madam,
Yeah, go ahead.
thou shalt not use computer to steal.
Yeah, someone here already said that.
That are not use the computer to harm other people.
Yes, we shouldn't use our access to a computer to harm or to cause harm to other people. Okay? All right, thank you very much. Good job. You want to say something?
Thou shalt not use intellectual output. I forgot the rest.
No, see, do not memorize, understand. You should not use your computer, right, to spread intellectual knowledge that doesn't belong to you. If you have to use other people's work, you have to seek their permission. Okay? You have to seek their permission and approval before you do that. Okay? You understand that? If I wrote a project, okay, and that project, right, maybe solved a problem or I was able to do something with it, please always remember that if you have to use it, even if you have to quote a sentence or more for my project, you need my permission before you do that. Okay? You have to ask me and have to approve before you can do that. Okay? Thank you very much for that. Okay? All right. how can we protect our computers? Okay, how? What are those things we can do to protect our computer? Everyone will give me one thing they do or they can do. All right, let's start with you.
You can be careful what website you're going and the two download.
Okay. So you need to be mindful of what you download onto your computer from the internet. Okay? All right, any other person? Yeah, go ahead. Then to raise your hand this way. Don't raise your hand and do this.
We need to put password on our PCs.
Okay. You said what? Can you repeat
Prince, Prince, what did you say? Oh, he said you need to put password on your PC.
that?
Yeah.
Okay, yeah. Okay, use of password,
Mhm.
okay?
You need to update your computer security always. You need to update your internet security always.
Hold on for me, Clifford. Clifford,
Let him
uh-huh.
finish now. Yeah, Juliana says, beware of links sent to you by unknown people, okay? Yeah, Clifford, what did you say? All right, so she mentioned that ensure that you always update your softwares, okay? Especially your operating system. The operating system that most of you use today is Windows 10, okay? And every month, there is an update from Microsoft, okay, that is pushed towards all your computers, okay? Ensure that you always update your softwares. And the reason why you update your softwares is all because of the protection, okay, that Microsoft pushes along with that update, okay? So ensure that you always update your softwares. And then we heard from Tim Ghana that you should always have a strong password for your accounts, either to log into your computer or if you have social media sites, make sure the passwords are very, very strong, okay? What are those things that you shouldn't use as your password? There are some things you should not use as a password. Your name, okay? Your birthday,
Your age.
your wedding date.
People do. Yeah. Somebody saying something.
Okay. Yeah, what did you say? Your pet's name,
Mm-hmm.
okay?
Age.
Your age.
Your age,
Mhm.
okay? Don't include your age as your password. What else?
Your birthday. That's all. Your birthday.
Don't use the name of your street as a password.
Mm-hmm.
Yeah, do not use any password that can easily be guessed.
Mm-hmm.
Like, don't set your password as 1, 2, 3, 4. Maybe the PIN for your phone.
Password for tablet.
Yeah, don't set your password as PASSWORD. Okay. So if you have to set your password, okay, there are ways you can set your password. Okay.
Like Face ID.
I'm sorry.
Like Face ID.
Yeah, so you can embrace the new technology like Face ID, right? You can use that.
You change it. You can.
All right. Okay, how, David, right? Okay, now, we've said we should not use passwords that, yes, okay? We shouldn't use passwords that can easily be guessed. Okay, go ahead.
Use uppercase and lowercase letters, symbols,
Yeah, that's
and
better.
numbers.
Okay, yes. So always use passwords that include uppercase, lowercase, and special characters. So if you are setting up a password, ensure that your password includes uppercase, lowercase, and special character. Okay? All right, what else should you think of if you want to set a password? Yeah, go ahead.
Anything with a random, anything that's random, because you can't have a session that's really random or gibberish.
So when you are making up your password, always think of a phrase, okay? When you want to set up your password, think of a phrase and then merge the phrase into a single word and then set it as your password, okay? Do not use a word that you have in the dictionary as your password, okay? So do not just look at your dictionary, pick out a word and set it as your password. No, okay? Always think of a phrase, okay? A phrase could be, I walk to school, right? That is a phrase. You can have that all together and then use that as your password, okay? I walk to school. So the I can be uppercase, the W can be lowercase, the A can be the @ sign, okay? And you can form a very secure password. Also, we talked about why it is not a good idea to share your password with anyone, okay? Never share your password with anyone. And the reason is that when you share your password with someone, right, they can use that password. They have access to everything you have in your account, okay? And if they send any email or they send any chat using your account, you are liable to it, okay? So do not share your password with anyone, okay? Another question. How often should we change our passwords?
Not that much.
Once a month.
Once a month?
Once in 3 years.
Once in 10 years? Good.
I said 3.
I would say about like a year.
But I think it's.
Every
single time it's been compromised.
To be honest, yes, I would do that.
So you should wait till your password gets compromised before you change it.
Yeah.
Like imagine.
Because nobody would ever know.
Change it very recently, you're never gonna remember. Or if you wait too long, like 10 years, and you change it, most likely you're gonna continue putting in your old password and forget your new.
Okay, and thank you for being real. Okay, yeah, go ahead.
Every 90 days.
Every 90 days. You should change your password every 90 days. And why do you think it's important to do that? See, Ghana, we just heard that we should change our password every 90 days. Why do you think it's important that we do that? Okay? Anyone? Why do you think it's important that we change our password every 90 days? Juliana, the forensic expert.
To ensure that it's not easy for other people.
Our password every 90 days. Okay.
Anybody in Ghana?
Yeah, I'm waiting for someone from the Ghana team to tell me why.
To make it difficult for hackers.
Sorry, speak louder.
To make it difficult for hackers to hack us.
No.
Ghana,
Is the volume, is it the volume that is?
no, I think it's from.
Okay,
Yes,
click
sir.
on. We couldn't hear you.
make it difficult for hackers to hack us.
Oh, to make it difficult for hackers to hack. Okay, so yeah, you are correct. We change our passwords every 90 days just in case, a hacker or a malicious user already gained access into our computer, okay? Or if our password have been compromised, changing it regularly will ensure that no one will have, permanent access to our account. Okay? Always remember that it is advisable to change your password every 90 days. Okay? All right. So what other things can we do to keep our computer safe?
Install a VPN or an antivirus.
Okay. Yes, by installing an antivirus, or when we are making connection to the internet.
We're not. Okay. We're doing this. Yeah, we're watching us.
Why? So when making connection to the internet, we can use a VPN. Okay. So installing an antivirus will really, really help in assisting us to protect our computer. Okay. Now, there is something that is close to an antivirus that we can use as an antivirus that comes with our Windows 10 operating system. What is it called? So we all have a computer assigned to us, right? And the operating system running on our computer is Windows 10, right?
I got Windows 11. Yeah, he upgraded.
I'm sorry?
He upgraded.
Okay, you have Windows 11. Okay, if you have Windows 11, that is fine. If you have Windows 10, that is equally good. Now, there is an antivirus that comes with Windows 10. And what is it called? We didn't talk about it.
I don't remember.
Okay, did we talk about Windows Defender?
Yes, we did.
The Windows Defender.
Yes.
We did, right?
Yeah.
Yeah. The Windows Defender is to protect your computer. Okay. So if you don't have an antivirus, or you did not purchase what we call a third-party antivirus, you can always use the Windows Defender. Okay? All right. Do you have any question for me? Any question? Do you have any question for me? In Ghana, do you have any question for me?
No.
No? All right. So guys, just to round up again, today is our last day. I hope you guys have learned a lot about cybersecurity. We're gonna continue, right? After the break, we're gonna continue talking about cybersecurity. And as you saw today, we're gonna be bringing in experts to tell you about other fields also, okay?
And you will set up your own virtual machine when we come back.
Yes, we will set up a virtual machine for everyone, and so that you know how it really works, okay? And David, we're gonna get somebody from DC United to come and talk to you. Yeah, go ahead.
They have a virtual machine over there.
Over where?
Over in
The library.
no, it's down in here. In that little area. where
Yes,
Heather
motion
is.
calls.
Yeah,
Oh,
in that
okay.
big box area by the back where the data thinners are, there's a virtual machine. A
Okay.
VR headset. And
Okay, that's good. But yeah,
Oh,
so
God, virtual reality? No, that's
Oh.
different.
oh, it is?
Yeah.
yeah,
Yeah.
virtual machine is different.
From
So
the VR.
That's
we're gonna be installing.
Must be not VR.
We're gonna be installing a second computer
In your
onto
computer.
into this computer, okay?
You have to.
You all have one computer right now, okay? So we're
Mhm.
gonna be installing a second one into it, okay? So when we return from the break, that's one of the things we're gonna be doing, okay? And also know that for you, you can always join us wherever you are, okay? You can connect when you're in New York, at least you know the time that we do come online. Just like the team in Ghana are connecting, you also can connect and, continue the classes with us, okay? Also, remember, the reason why we're here is to learn and use our knowledge to help others, okay? I hope you're listening to what I'm saying. The reason why we're here is to learn and use that knowledge to help others. Okay? We are not here to learn just for ourselves. Okay? Learn and also pass that knowledge to other people around you. Okay?
Uncle Nee is doing that. He's giving back. That's so.
Why are the team in Ghana not eating anything? They'll be looking at people here that, oh, why no, nothing was organized for them.
No.
Oh.
I had to wait for birthdays and stuff.
Oh, okay.
Yeah.
Okay, well, team in Ghana, right? Hopefully one of these days or very soon, I'm gonna meet you guys.
Next
Okay.
year, hopefully he will come
Yeah.
to Ghana with us.
Yes, and maybe one or two of you guys will also go along with us on that trip. Okay, I really love to meet you guys, and thank you for always showing up every week. I know it's not really easy. Yeah, I know you guys have to go through a lot to be here. Thank you all, and I'll talk to you guys after the break.
Yeah,
Okay.
on the 9th, on the 2nd, they will join on Zoom, so you can join on Zoom at
Okay.
home and chat with them.
On the 2nd.
Yeah, of September.
What time?
I will text.
Okay, just text me. Text me in advance.
I know.
Because I have a lot of.
No, it will be in the morning, like regular time. Like
Okay,
this.
okay, yeah, then I'll join. Okay. All right, thank you
Okay,
all.
guys, so we will end our Zoom session.
Okay, thank you.
Let me start.